We actually have an eye chart above that because we find that patients' eyesight gets better if they are removing infection from the mouth. Again, a few centimeters away, it's all related. So that's one thing that we do that's pretty impactful. It's just a simple little eye chart up there, and we find that there's benefit. Other things that are helpful for patients, like I said, we do a lot of airway work. So even in dentistry, by helping a patient breathe better, sleep better, a lot of things happen, as you know how important sleep is. We've had patients who are on, drug-resistant hypertension, so they have high blood pressure, and it's really hard to manage with medication. Once we're able to help them sleep better, breathe better, put their body back into a parasympathetic state when they're resting, they find that they're able to better manage their high blood pressure.
Your body has been speaking to you your entire life, and learning how to listen changes everything. This is the Underlying Answers podcast. It's time to restore the design. Today, we're exploring a topic that many people have not really considered before. I have to admit, I don't even think about it. And functional health is everything to me. But when it comes to my oral health and thinking about it from a functional perspective, it's really not something that I've expressed or been interested in until this wonderful interview today. So I'm super excited because for many of us, dentistry has traditionally been viewed as something separate from our overall health, something outside of the whole body health. When we look at what's wrong, what symptoms do we have, why are we not feeling great? We tend to not necessarily connect our mouth and our teeth to that whole equation. But what if the mouth is communicating far more than cavities and gum disease? What if it offers insights on inflammation, chronic health challenges, and the body's interconnected communication systems? Joining me today is Dr. Chubbi, a functional dentist who approaches oral health through a whole body lens. Her work explores the connections between the teeth, body systems, and the fascinating concept of tooth meridians, which I'm really excited to jump into, inviting us to consider how what happens in the mouth may reflect or influence what happens throughout the rest of the body. Again, super excited to have this conversation on meridians. Dr. Chubbi, welcome to the Underlying Answers podcast. I'm so excited to have you here.
Thanks for having me. I'm looking forward to a good conversation.
Yeah, me too. And so let's just jump right in. I just want to kind of start with, just talking about dentistry in terms of functional medicine, because as I mentioned in the intro, I have spent many years now working with functional doctors, and I never have considered my mouth and my teeth and my gums in that same equation. And so I'm really just fascinated by this and intrigued and excited for the learning and what I can learn from this in terms of my overall health as well. So when we think of most people, thinking of dentistry, we think of the teeth and the gums, right? Just like we said. But I'd like you to just start with just an introduction. What does it mean to be a functional dentist? How is that different from traditional dentistry? And why did you jump into this field yourself?
Sure. So functional dentistry, in my opinion, just makes sense, right? So functional medicine or functional dentistry, what are we thinking about when we're talking about a functional aspect to health? Is thinking about root cause, is thinking about big picture, is taking away the symptom and looking at everything as a whole. So functional medicine and functional dentistry are one and the same. We can't really look at just the teeth without considering the whole body. Can't look at the gums without considering the whole body. They're inside our mouth, right? And our mouth is inside our body. That's just a few centimeters away from our brain, from our eyes, from our heart, and everything travels in a system. Just like if you eat some food, those proteins and amino acids are going to go help build the muscles of your tongue. They're going to go help build the muscles of your legs. So it's silly to think that the mouth is completely separate from the rest of the body because it all talks to each other. And why did I get into it? I mean, it's something that I've been really passionate about in general in my own life. I like to be healthy. I like to eat well. I like to exercise. I like to stay up to date on the different researches of functional medicine, of longevity, of what it means to live well. And so it just made sense that our office and the way that we practice would be complementary to that kind of philosophy.
Yeah, I love that. And, you said it's so silly not to think of it. And as I'm sitting here listening to you, I'm giggling inside because it is silly. Everything, all my work talks about how we are one interconnected system. Yet I brush my teeth, I brush my gums, I go to the dentist, and I don't really ever think about those. And I imagine a lot of my listeners are thinking the same thing. So this is really exciting to have you on. And I'd like to know, like, what was that turning point for you? At what point did you just say, wait, dentistry isn't just about the mouth and the gums, it's about the whole body system? Is that just kind of a long standing belief you've had, or did that kind of show up in your life through some experience or, way you practice? Like, how did that come for you?
Yeah. So I think it's always been, a steady trajectory towards this philosophy with different inflection points where things got more connected. Definitely when I started in dental school and I was studying, our school was really focused on making sure that the dental students learned about the whole body. So for the first 2 years, we were fully integrated with the med school classes. We took the same courses that they did. We did the same rotations around the hospital, took the same exams. There was no differentiation between the two of us, the two groups. Then in years 3 and 4, we separated, then went to the hospitals, and we went to the dental clinics and focused more on our profession. So that was kind of the first inflection point. Then I went, practiced. As I mentioned, it's just generally how I like to live, focusing on nutrition, focusing on health. But then I started learning about sleep apnea, and that really changed the tone. Because you think about dental procedures, teeth, gums, but then you start thinking about sleep apnea, that's a whole different monster. Once you see the connection about what sleep has to do with the mouth and what dentistry has to do with sleep, then you really appreciate that there's a mouth-body connection. And now somebody can open their mouth for a dental exam, and I can guess if they're snoring, if they lack for breath at night, if their sleep is compromised. And so I think that sleep apnea was that second inflection point and be like, wow, on the outside, this has nothing to do with teeth, but it's so severely related to the mouth. You just can't unsee then the links between the mouth and the body at that point.
Yeah. Wow. Yeah. I can totally see that. I can think of a few clients right now that I'm working with that, are experiencing sleep apnea and have different challenges. I don't want to get into things for their personal sake, but, we go and tie everything back to the originating event. And you're saying, like, helping me see that it's even more evolved around just the nose and the breathing. It's the mouth as well. So I'm just, my mind is kind of spinning right now, like, what have I not seen for her?
Could be so multifactorial, right? And so our job is to make sure, as a functional dentist, is there any contributing factors to systemic health? Anything in the mouth contributing to the rest of the body?
Yeah, I love that. It was a functional doctor that originally said to me, and I had tried everything. I was very, very ill. I don't know how much you know of my story, but I was very, very ill for over 34 years. And then I was dying, and I just couldn't get any answers. And I sought out a functional Western doctor. And the first thing he said is, tell me about what happened to you when you were a child. I'm like, what does that have to do with anything? Right? I had no idea. So when you think about from that perspective, how does that also impact you as a dentist, thinking about going way back? Because he's really the one that enlightened me and said, your traumas have everything to do with your health issues, right?
Oh, yeah.
And I imagine that has to do with our teeth and our gums as well. I know for one of my clients, it's very specific to her tongue responses, and she has very immediate response to all scents through her tongue. So she feels the scent through a reaction in her tongue before she even smells the scent. It's a physical reaction. So how do you tie all that in to the work that you do?
Yeah. Great question. And there's so much, right? I think if a practitioner wants to, that's why we work as a team, right? There's not one thing that we can all just handle by ourselves. It really takes a group with similar philosophies. But in our end, I definitely believe in looking at past traumas, how things shape us. Our mind is so important, such an important carrier of what the rest of our body does. But we ask our patients from the very beginning, more structurally, but it's all important. We ask, were you carried to term? Were you preemie baby? Were you born vaginally, C-section? All of those things matter actually in our work. Were you breastfed? And just taking it from the beginning, even before they were born. Tell us all about those steps, because they do show up in their care and how we provide for them.
I just got goosebumps. So true, because it really shows up in every aspect of our life, right? So of course it makes sense that it also shows up in our mouth and through the work that you do. So let's jump in really quick to meridians. I am super excited about this topic because I work directly with meridians in the body. And so I'd love to hear your conversation around it with regards to our mouth and teeth and gums and, seeing a dentist.
Yeah. Amazing. So, as you know, but maybe our listeners need a little recap. Meridians are the idea that, our body is connected through energy channels, right? It's a very common in Chinese medicine. Maybe we think about like reflexology, where different points in the feet and how they related to the rest of the body. So, teeth have their own meridian chart as well. And each tooth is connected to an organ system, a joint system. And we look at that to for more data, to put more of the pieces of the puzzle together. And it could be related to different diseases in the body. Maybe a long-standing infection in the tooth could then start leading to pain in a shoulder, or could start leading to blurry vision because it's inflammation, it's disease, and it's traveling down the system into another area. I can give you a good example actually of a relative of my husband, because he knows we do this work, and her son is a doctor, and she's had pancreatitis for a while. She can't keep anything down, always vomiting. He's done all sorts of tests. And then my husband asked, he's like, could it be in the mouth? Right? He's a good student. And so he said, I have no idea. Let's find out. And so we did a workup, and she unfortunately had 4 infections in her mouth, and 4 of those teeth were on the pancreatic meridian. Imagine all of this burden on her system, her body just trying to fight these low-grade infections that have been there for a long time, right? They don't cause fever, they don't cause like frank pain, but there they are brewing and wreaking havoc on the rest of the system. So she got them out, and she's feeling a lot better. She could finally eat again. Her pancreas is starting to heal. So it just goes to show, like, it's not magic. The body is just connected, and low-lying infections travel. Right? Those antibodies, those white blood cells, those are just trying to figure it out, but they get a little confused. Yeah. So that's kind of how the meridian works in our in our line of work. We check to see, what do we have, what's infected, what is the body rejecting, do they happen to have other symptoms in the rest of their system that we can correlate and relate to further encourage for the patient for healing.
Yeah. And so thinking about what you just said, and I'm such a visual person, and I can visualize like the meridians in her mouth were connected to her pancreas, right? And so the infections were directly affecting her pancreas. So can you talk about some of the experiences you've had, beyond that, where, doing this dental work, taking care of your teeth, keeping up with your health of your mouth, because let's face it, that is something that a lot of people ignore, right? It's one of the most biggest fears that people have, that we tend to have, is going to a dentist and seeing a dentist. So how can, like what experiences, what examples do you have of people that have been to the dentist and then other areas of their health have improved as well? Because I think that's a huge example. And I'd love to hear more of that, if you can explain. It doesn't even have to be regarding the meridians themselves, but just overall health of your mouth impacting the overall health of your body directly.
Yeah, of course. I can give you a couple of examples. One example in our surgery room, where we do our more intense procedures, usually patients in a dental chair, they're lying face up, and so they're looking at the ceiling. We actually have an eye chart above that, because we find that patients' eyesight gets better if they are removing infection from the mouth. Again, a few centimeters away, it's all related. So that's one thing that we do that's pretty impactful. It's just simple little eye chart up there, and we find that there's benefit. Other things that are helpful for patients, like I said, we do a lot of airway work. So even in dentistry, by helping a patient breathe better, sleep better, a lot of things happen, as you know how important sleep is. We've had patients who are on, drug-resistant hypertension, so they have high blood pressure, and it's really hard to manage with medication. Once we're able to help them sleep better, breathe better, put their body back into a parasympathetic state when they're resting, they find that they're able to better manage their high blood pressure. We've also found, the links between gum disease and cognitive health. Those are more long term. We don't see it as acutely, but anecdotally, we do notice that our patients who come in with more full set of teeth in their 80s and 90s, they're doing much better, right, than those that are missing a lot of teeth. And we wonder if it's just, is it a mindset? You take care of your teeth, you take care of your body. Or is there something there about not having your teeth, maybe not being able to chew well, maybe not having a balance on your system? Because our teeth help us to stay upright, right? Our teeth are kind of our crutches, just like our feet are, to help us find ourselves in space. And so there are some ideas there too that our teeth are important for balance and for preventing falls when we are older as well.
So yeah, there's so many links that I've honestly, I'm just kind of sitting here a little bit like perplexed because I want to go see a functional dentist now. I love my dentist and I want to switch because I want to have these conversations that run deeper beyond just, cleaning my teeth and getting my gum, making sure my gum health is great, because it is, everything's linked, every part of us. And so you can, especially I could see sleeping, learning, if you are getting rid of that sleep apnea or helping with the sleep apnea and sleeping better at night, that affects, it impacts us in many, many different ways, right?
Right. Sleep is so important. So
yeah, let's talk about stress because so many people are under huge amounts of stress right now, right? Internal stress, external stress. How do you see stress showing up in the mouth, if anything? Do you see that? Like, do you see a direct correlation to stress and anxiety or, with our mouth, or do you not really correlate those specifically and directly?
Yeah, we do. A lot of patients will come in because of stress and anxiety, and it comes up as grinding their teeth at night, having headaches, jaw pain. We see that obviously we saw that a lot during the COVID era. There were so many changes in the world, lots of variables, people being increasingly stressed. Unfortunately, cracking their teeth because of those high pressures. And so our body, I don't know why yet. I always like to understand why our system does something, but grinding our teeth at night or even during the day, that like clenching feeling helps us to reduce our stress. So something about moving that jaw and putting pressure helps our body to calm down, unfortunately. So we do see that as a direct result of patients who have stress and anxiety.
Yeah, I can see that. When I first started healing, I think it was actually my functional doctor. It might have been someone else. It's been a while now, but he said, stretch your mouth, stretch your jaw because you're holding so much of your stress. And I didn't feel like I was under stress because my body processed all my stress physically. So everything was a physical manifestation. I didn't have mental depression, anxiety, but physically my body was carrying all of that. And so my jaw was one of those places where and so I learned to stretch and open my mouth wide and start that every morning and just, because at night, for some reason I do tend to, crunch my teeth and I don't grind them because my teeth aren't, being ground away, but might have tightness in the jaw every morning when I wake up. And so I start by just stretching my mouth and I do this weird exercise and it sounds funny and it looks funny, but it really helps to loosen this whole area.
Right. Yeah. Stretching is very important. Obviously fascia also holds a lot of our tension, that the tissue that surrounds our muscle. And we see that too, very like tight muscles, tight fascia. That's something a little also that we work on with a lot of patients is something called tongue ties. Where we are more tethered down, tight fascia. If you think about it, I try to explain it kind of like if you have a table cover on a table and you pull one corner of it, the other corner is going to also want to come with you. Same idea as like this fascia that goes from our head to our toes. And if that's tight, that can also lead to more clenching, more grinding, holding more stress in our shoulders and neck. And so we try to help patients through that too to get that relief.
Love that. I'm going to do that.
All right.
Thank you for that tip. When I think about functional medicine and functional dentistry, they really do work hand in hand with each other. And so I guess let's jump into, because I know you have to get going, but let's jump into where can people find you? How, where are you located and why would you recommend someone seeing a functional doctor? And I don't want you to put down regular dentistry because I know you guys are equal partners and everybody's doing their job and doing their own work, but just kind of a little hint on someone like me and others that have never tried functional dentistry. What would be the benefit of saying, I'm going to try someone new. Let's look at a different perspective and see how that might be able to help me. What would be some things that you could kind of tell my listeners to think about when they look at who they want to choose as for a dentist?
Right. And you're absolutely right. Everything has its place. All providers really have the best intentions, and what could be good for one patient might not be good for the other patient, right? So you're right. In our office, we don't see a lot of simple cases. We see a lot of people who come in who've been looking for answers and haven't been able to find them, right? So that's what I would, recommend. If there's somebody who's having brain fog, fatigue, just not feeling their best, and mostly if they've gone to see other people, and why not shoot your shot? Try to see if there's something in the mouth, right? Because if you checked all of your other body symptoms, it's worth taking a look in the mouth to see if there's anything that's been missed. Things that a functional dentist might work on that don't seem like exactly related to teeth, like we mentioned, the meridian. So body systems where you can't find answers as to why something is happening, why you're feeling off, even to posture, even to snoring, neck tension. Those are all things that sometimes could be related to the mouth, right? Not always, but again, it's worth giving a look at if you've gone to all these other specialists. Our practice is in the Boston area in Massachusetts, but if somebody is looking to see who a functional dentist is, you can, usually a Google search. There are some societies and associations that functional dentists or biological dentists like to belong to. One of them is the IAOMT. That's the International Association for Oral Medicine and Toxicology. So that is one directory that could be helpful. They do they work on safe amalgam removal, safe infection removal, things like that. And then things to generally ask that functional dentist is to ask them, you could always interview your dentist. We do a lot of discovery calls, complimentary few minutes to just chat and see if you're a good fit. You can let them know about what you have going on and seeing if they might be a good fit for you.
Yeah, why not? So you said you tend to get more advanced cases. And what I'm really passionate about is really trying to help people look at those options before we get so desperate that we need them, that we're so forlorn about that having no answers and getting bitter about Western medicine and Eastern medicine and even functional doctors and the bitterness. I don't mean that lightheartedly, because it comes from feeling let down, right? Because we can't get answers. So when I hear you say that, I want to say, let's go see a functional doctor before we get to that desperate stage, right? Before we get to where we have no answers. Right. When we just want to really focus on that preventative medicine in our mouth as well, right? With our teeth and our gums as well, and not wait until we're so desperate that we're just seeking anything that we can for answers, which is what I did. I'm not trying to be a hypocrite here. It's what I did, but I almost lost my life for it. And my healing journey was a whole lot harder because I waited so long. And so I'm just grateful that you came on today and just educated us, opened our eyes about functional dentistry, because it's really, truly, maybe embarrassingly, a little bit of a new concept for me, even though what functional medicine is all that is my route. It's what I choose for myself. So I've never connected.
Yeah, no, thank you for the opportunity. I think we covered a lot of interesting ground, but even leaving your listeners with the take-home message of there is a lot more to see in the mouth, and to be able to explore that, not dismiss it, and your answer might be there.
Yeah. Thank you so much. Thank you for being on and for just enlightening us a bit. And I'm going to seek and see if there's a functional dentist in my area so I can go interview.
There you go. Very good.
All right, Dr. Chubbi, thank you so much. Do you want to talk and say anything about your practice? I know you're in Boston and you don't do remote work, I'm sure, as a dentist. But...
So we're in the Boston area. Our office is called The Flossery. You can find us on Instagram or online at myflossery.com. We don't do remote work per se, but we are always happy to review CBCTs with patients. Those are the 3D x-rays that you can get at a dental office. We love a CBCT. It gives us so much information. It can find underlying infections that you may not know you had. It can take a look at your airway health to see if you might be more predisposed to breathing issues, snoring issues. It really gives a lot of information. And, if I encourage a listener, if they have a CBCT or they get one from their dentist and they want to go over it with us just to see what is possible, and then they can see a dentist near them for those answers, we're happy to do that. But that's usually the first step in trying to understand if there's anything below the surface. Mm-hmm.
Perfect. And we'll put all your contact information in the show notes. So if anybody is just like, I need to talk to these people, they can give you a call. All right. Thank you so much again for joining us and for being here today. And
Thank you.
Yeah, you have a beautiful day.
Thank you.